Okay, hopefully I am recording. I need to move just a tiny little bit. Okay, guys, thank you so much for volunteering for my community assessment project. This is going to be over substance abuse, specifically marijuana misuse and excessive alcohol use. I'm going to share my screen here. Okay. Okay, so this is the cover. We are going to be discussing SBIRT, what that acronym means, and specifically how we can better use this as nurses for our patients. If we have a patient that has a substance use disorder. Okay, so a little bit about my community. I live in Princeton, Illinois. That is part of Bureau County. It's a small rural community. Our community really emphasizes a lot of different community programs and get-togethers. During the summer, we host lots of music fests on our main street. It's a really good way to raise money within our community through organizations such as United Way. Also, it really helps establish some of our brick and mortar buildings for more of the population to buy things and really support those small towns or small storefronts and restaurants. And we have an ice cream shop as well. Also within Princeton, we do have several restaurants, like I said, all up and down our main street. We have several bars, little bistros. We have a few nursing homes and then one major hospital that is OSF affiliated. Bureau County houses a lot of little rural towns, Princeton being one of them. The population size of Bureau County is 32,827. The percentage of males that we have are 49.8%. The percentage of females is 50.2%. And our main race and origin is Caucasian, coming in at 95.4%. We also do have African American alone is about 1.3%, and then Hispanic is about 10.5%. Bureau County, like I said, has a lot of similar smaller rural towns that it covers for those 32,000 people. So education, I have broken into two different groups, people that have graduated high school, and then also ones that have obtained a bachelor's or higher degree, such as graduate school. So I was a little surprised by the statistics, the percentages on this. We do have 90.3% have graduated from high school, which I thought was a little low. But what I thought was extremely low is individuals that have obtained a bachelor's or a graduate degree, such as master's or a doctorate, is only 21.5%, which I thought was extremely low. We have a lot of diversity within our towns within Bureau County. We have a lot of hospitals, engineering, doctors. So I just thought that that percentage would be a little bit higher than 21.5%. The poverty level is extremely high. For 32,000 people that Bureau County houses, that's falling into 12.6%. And that is actually 0.7% higher than the national average for, or the state average for Illinois. It's 0.7% higher. The median household income is about $64,165, which is $14,268 less than the state average. So we are about $14,000 less than the state average for our median household income. Marijuana use disorder is at 1.8%, which is 0.2% higher than the national average, which I thought was a little high. Of course, under medical use or recreational, it is legal in the state of Illinois. But of course, certain jobs still do drug testing for THC. So it's always it's always a good idea to make sure that, depending on what type of job your patient has or that you have, if that is something that is even remotely acceptable for your employer, if you were to have that in your urine. Substance use disorder is 8.0%, which is 6% higher than the national average. That is insane. And that covers the whole scheme of any type of substance disorder that we'll be talking about today: marijuana, any type of drugs, and alcohol. Excessive drinking for the county. Bureau County is 18%, which is 3% higher than the state average. And remember, I talked about how we do have several different bars, little bistros that really emphasize how, come and, hang out with us at the bar, come and, drink these certain cocktails, which is all great on an as-needed basis or on a very limited basis for health reasons, of course. But that is appalling that we are 18% for excessive drinking. So that's something that we as healthcare providers really need to hone in on their, extracurricular activities, and how that is going to affect their health, especially for long term. Alcohol impaired deaths are at 36%, which is 7% higher than the state average, which is also coming in at 15 suicides, which is 4 more than the state average. So the first problem that we're going to discuss is marijuana use disorder. So we have 1.8% in Illinois, which is 0.2 higher than the national average. The NIH shares that marijuana use is likely to precede the use of other illicit substances and the development of addiction to other substances. Basically, there was a study from the National Epidemiologist study of alcohol use and related disorders that found that adults who stated that they used marijuana were actually more likely to develop an alcohol use disorder within 3 years of starting, which I thought that was really interesting, how both of those kind of combined. Marijuana use is also linked to other substance use disorders, including nicotine addiction. Any type of early exposure to cannabinoids in adolescence decreases the reactivity of the brain dopamine reward centers later on in adulthood. So that's really messing around with those neurotransmitters, and also how that is going to affect their overall cognition, and also how they are going to how their brain is going to develop. So basically what that's saying is that if teens or younger than that are going to be exposed to any type of cannabinoids, THC, it really does decrease that activity of that brain dopamine later on as they become adults. And then also this can explain the increased vulnerability for addiction later on to other substance misuse later on in life. So again, that can set them up for significant failure early on in adolescence if they are using marijuana, such as alcohol misuse that we talked about, also for any other type of drugs that might kind of start the transition in their journey on other things that they would like to try. Okay, so the next problem we're going to discuss is excessive alcohol drinking. Like I said, we do have lots of little bars, not only in our town, or my town, Princeton, but also within all of Bureau County. We do have several different little bistros and bars that really put an emphasis on, let's hang out, it's fun, not only on the weekends, but during the week too, when that's a huge problem, because, you're drinking every now and then, that's not a problem. But when we're trying to promote things during the week, that's when this excessive drinking misuse can quickly come into play. So the percentage for Bureau County for excessive alcohol drinking, like I said, is 18%. And I shared that that is 3% higher than the Illinois state average. Alcohol also interferes with nutrient absorption, which leads to thiamine deficiency and subsequent central and peripheral nervous system dysfunction. So a lot of times, I work on an acute neural floor. We have lots of psych patients, a lot of people that are alcoholics, not only like strokes, but all of that kind of just ties in together, as we know that the body, we need to have, thank you. I'm so sorry. My daughter's just, she made a watermelon. Okay. All right. I am recording right now, so you need to go away. Okay. So as we know that we need to have certain nutrients in our body for all of our body systems to work properly and efficiently. So we have a lot of alcoholics on our floor, a lot of people that are going through withdrawals from, either meth, cocaine, other types of substance abuse. So a lot of times, we've always heard that description of hanging banana bags, for alcoholics. Well, also a lot of times they need thiamine replacement. So we would do like an IV push, hang a bag of magnesium. Sometimes the potassium needs to be replaced. Of course, then we're having to check, EKGs, have them hooked up to tele to monitor their heart functions. So a lot of this just really comes into play. Of course, we know that alcohol not only can trigger hypertension as well, it accelerates, hypertension accelerates the coronary artery disease, also increases the triglycerides and the low density lipoproteins, which can end up leading to cardiomyopathy and MIs, heart failure, and then, of course, stroke. So that's why a lot of times we end up seeing on my floor specifically, people that are alcoholics, they've also had strokes because they've had that hypertension as well, which has just kind of delayed that blood flow to that brain as well. So like I said, drinking too much alcohol, such as this excessive alcohol disorder, actually increases your blood pressure. The drinking thins out your blood as well. So that can also be an issue as well for people that have anticoagulation problems or antiplatelet issues as well. Alcohol or high blood pressure, high blood pressure, such as hypertension, is also associated with over half of all strokes. I'm not really sure why this happens, but it is found that regular drinking can actually lead to damage in your circulatory system, which increases your risk of stroke. So basically, as your heart and your brain are all working together, having that alcohol in there is obviously excessively alcohol, I should say, is actually not only destroying your heart, but it's also putting you at risk for a stroke, thus because of your hypertension. Alcohol impaired deaths are at 36%, which is actually 7% higher than the state average. Okay, so this whole presentation is over substance abuse, of course, but we're going to be talking about SBIRT elements and what that means for us as healthcare providers and how we can better serve our patient population with these issues. So SBIRT is an evidence-based approach to identifying people who use drugs and alcohol at risky levels. And of course, risky levels would be the excessive alcohol intake or misuse of marijuana, or any other type of substance type of drugs. This tool, as SBIRT, has been shown to be reliable in identifying and improving outcomes for people who use certain substances. This is comprehensive, integrated approach to help deliver early intervention and treatment services for those who have these types of disorders. There are 4 steps in the SBIRT process. So we're going to run through those. So S would be for screening. The BI is brief intervention, and then the RT is referral to treatment. So we're going to talk about the steps and then the phases and how we're going to be able to better care for our patients with these types of substance abuse disorders. So phase 1 is establishing a rapport with your patient by ensuring confidentiality and administering your assessment. So of course, when you're going to have a patient like this, they're probably going to be very, maybe they don't want to be there. Maybe they're forced to being there. So they're going to be really hard to open up to, and really to be able to get a thorough assessment and what is going on. We really want to maintain good composure, being non-biased, and really making sure that they are feeling like they can trust you, not only as a healthcare provider, but as a nurse. So our phase 2 is providing feedback from your assessment. So this would either be letting them know what you think would be the next steps, or developing a care plan that you can share with your team. Identifying the pros and cons of the assessment, and provide education. So providing education in why we should probably slow down on the alcohol. You are at risk, for hypertension. This is putting you at a high risk for strokes. We also, checking the depression. Is there anxiety? Are there different types of therapies that we can maybe, start to try? Background, what is their baseline for their average daily life and what they're doing? Is this a family history? So really kind of just digging in on just the whole picture of the assessment rather than just the now is really important for providing accurate treatment for your patient. Phase 3 is going to enhancing motivation. So how can we increase the motivation for this patient to want to get help? How can we increase them to stay in treatment, such as, some type of therapy, whether they're wanting to, how are they going to get there, which is what we're going to talk about, the referral to treatment. What is their readiness to learn and to change? So we're really wanting to enhance that motivation, making it known to them and exciting that it's a good thing, to slow down on these types of substance abuses or quit altogether. And then the last phase is the phase 4, which is making a plan. So we've educated, we've obsessed, we have educated, we're motivating them for this change and how amazing this is going to be, looking towards the future and how this is not only going to help you cognitively, but as a whole, and make you better and healthier. Now we're going to make a plan. We're going to summarize this session. We're going to invite them back to have another session and get that treatment going for them. So SBIRT use, how do we incorporate this into our assessment? Well, the screening part is the healthcare professional, such as us, would assess that patient for that risky substance abuse behaviors. And this would be during that standardized screening tool, such as SBIRT. Screening can occur in any type of healthcare setting. So whether you work in a doctor's office, which I know some of you do, are providers in doctor's offices, hospital, maybe nursing homes, or maybe even case management. We can do this there as well. The brief intervention would be the healthcare professional or provider engages in the patient showing these risky substance use behaviors. I know on my floor specifically, sometimes I'll have patients try to manipulate the situation, such as, oh, you know what? I would really like to just get some fresh air outside. Would that be okay if I just want to go outside real quick? Well, I know what that means. You're not really wanting to get fresh air. You're wanting to engage in some type of substance abuse that's not within the hospital setting and that you're not allowed to do. So really just assessing that and showing that risky type of behavior. And of course, we want to do that in just short conversation. What I normally say is, how that would be great. Unfortunately, I can't have you leave this unit right now, because the hospital really wants us to monitor you. Just kind of really thinking of something that, maybe we can sit by the window in your recliner. You can get that sun, get that natural vitamin D. Unfortunately, I can't open, maybe we could crack the window open if they're allowed, as long as they're not on, any type of other precautions, or maybe we can bring a fan in, kind of motivating them to understand that I can't allow you to go outside, but we can try this instead. And so we want to just do a brief conversation about that. We don't need to go into a whole long speech about it because they probably don't care anyways, because they're just mad at you that they won't allow them to go outside. And then we also want to provide the feedback and then the advice, like I just shared. We can sit by the window. You can feel like you're outside, maybe crack the window if that's appropriate for that specific patient, maybe bring in a fan. But, unfortunately, we can't leave that unit right now. Um, and then we're going to refer them to treatment. So a healthcare professional provides the referral for a brief therapy or any type of additional treatment for that patient who is screened and in need of any additional resources or services, such as a psych eval. Maybe they need some type of behavioral treatment, such as therapy. To kind of, talk about, sometimes case management needs to get on board as well. So what are the outcomes to ESPER? And how can ESPER impact the problem? So using motivational enhancing conversations to increase insight and awareness about substance use and motivation towards behavioral changes. This can be accomplished during a single encounter with your patient or multiple encounters. Brief interventions can be standalone, such as by like a one-on-one rather than just as a group therapy, especially for those that are a little bit more intimidated and don't really want everybody to know about their specific problems. Especially when you're in a small town such as ours, a lot of people know each other. And that can kind of get in a sticky situation because even though, certain areas such as like AA or, which would be Alcohol Anonymous or Narcotics Anonymous. A lot of people share a lot of things that probably shouldn't share outside of that circle. So sometimes people like to do more on one, so they feel more trusting and more secure. So it's more confident. We also want to motivate and engage those that are needing specialized care because this will lower the rates of alcohol impaired deaths and suicides by raising that awareness early on in that screening process. So some of our community resources, which we have, are Aruka, which is a fantastic resource. It's also a holistic health service that is right here in Princeton, Illinois. So we're very lucky to have this type of opportunity and service in our community. Aruka Institute of Healing is actually a behavioral health clinic that emphasizes the whole person wellness. So it's very holistic. It offers treatment and recovery approaches. They utilize modern social media platforms and youth events to inform and educate parents and youth about the struggles and reach out for guidance. So I love this approach because so many of us and younger adolescents are really into social media platforms, whether it be Facebook, which I do have listed here, their Facebook link, their website link. They're also on Twitter and I believe on Instagram as well. And I've also listed their phone number here too. If you want to write any of those down, feel free. Aruka is integrated treatment involving therapeutic practices that are tailored to that specific patient's need, which I think is great too. So it's not just like, oh, this is a catch-all. We're going to jump and dive in for this patient. No, it's tailored to that specific patient's needs. So they also do offer a walk-in crisis living room, which is really cool that they call it a living room. And that's available during substance use or mental health challenges. So where caring staff can connect with them and help them get the resources and the help that they need. So if somebody is under the influence or high or in drugs, and they just really are feeling down and they know that they need help, they can walk in just as is into this living room, a setting, and staff will come out and connect with them and help them get those resources and help that they need. And I think that is fantastic that we offer that. One of the most significant advantages of Aruka is our C5 Rural Collaboration Health, which collaborates with over 40 healthcare entities, schools, churches, and they're all being proactive and passionate about increasing access to mental health services and substance abuse treatments. And then you can also, patients can also just pick up the phone and call Aruka by dialing the number that I have listed here. Assessing our 4As. So community health nurses evaluate available resources using the 4As, which helps ensure that the resources meet the needs of those in the community. So acceptability describes whether the client has the confidence that the referral source will be able to help. So any past experiences, were they positive, negative, and how does that conflict with higher priorities? What is the cost to the client maybe? Is there any type of bias when using that resource? We don't want to discriminate on the bias of any type of race, color, religion, disability, sex, national origin, or sexual orientation in any of its activities or our operations. And then accessibility may be limited based on the work or their schedules, school. Accessibility on transportation. How are they going to get to this appointment? Do they have a ride? Do they have a license? Are they able to have somebody take them if they're not able or they're nervous to go on their own and they know they kind of need a push? Maybe mom or friend takes them every Friday, at 3:00. So kind of just developing a schedule and working around your own, or they can work around their own personal work or school schedules per, of course, the facility's open hours during that time. Does the client have any type of transportation, like I said? So really just understanding, gas, maybe it's the cost for the transportation. So just kind of looking at that as well. The availability. Is there a referral source that meets the client's needs? Aruka's hours are Monday through Friday, which are 8 a.m. to 6 p.m. So it's definitely a good range for people either prior to work. They could maybe go on their lunch break or after school. A lot of schools get out at 2:45 or 3 if they're within that under 18 years old, or even sometimes colleges around that time, they are open till 6 p.m. And then the affordability. I know we talked about the gas. How are they going to afford to get there? Does the fee offer any type of referral charge? Is there any type of sliding scale fee, such as, you have this service and then you have this one? Is there something that they just have? Do they have any type of third-party payments? Which is awesome is that the living room is free. So it's, like I said, it's an inviting space that's offered to any type of residents in our local communities, and it is free. By having patients come to this living room, this definitely frees up our emergency room. So I know I do have some of my volunteers that are ER nurses. So hopefully by having or sharing more help with Aruka, and having our patients really access Aruka's living room services, this is going to help have more of a holistic approach by clearing out your emergency room, because some of these issues are not clinical. They're not crisis. They're just having a hard time, But a lot of people are like, oh, you need to go to the emergency room. You need Narcan. Well, not all the time. Sometimes they just need a healthcare provider, a loving friend to just be able to speak with them and trying to get them the help that they need. And that's really not ER appropriate. So hopefully that helps kind of clear out those non-clinical, that non-clinical space. Um, um, the living room, or I'm sorry, that is going to help clear out that ER space by people that are experiencing those mental health crisis or substance use, again, which is free of charge. Of course, people that are not having an overdose or any type of, heart palpitations or things like that. That is not necessary to go to the ER. They could go to this Aruka, into this living room, which I think is fantastic. All right, wrapping it up here. Okay, so implications for practice. What does this mean? So this can cause cardiac related and metabolic issues, which we talked about. Metabolic issues such as a depletion in our potassium levels, our depletion in our thiamine, and magnesium. Those are our three major issues that we have for metabolic. Again, cardiac related, especially if we're having a decrease in that potassium, that can drastically cause us to have cardiac issues. Risky use can lead to other drugs that we talked about. So what does this data mean to you, and how can this impact us? Well, this can impact us as healthcare professionals and providers when patients are admitted into the hospital or come into the emergency room or our clinics. This impacts us based on the population that is seen within our healthcare setting. And this also puts a hold on others who may need direct care for fractured wounds or other issues that are life or death. Really trying to hone in on really clearing out, like we talked about, having non-necessary inpatient or people that are coming into our clinics or ERs that are not necessarily needed. And then having to put a hold on people that really do need direct care, such as fractured wounds or other type of bleeds. ASPR is associated with reductions in alcohol use and illicit drug use and diminished social costs related to automobile accidents or deaths. So incorporating this tool in our assessments are going to help lower those risks. So in conclusion, how can we make a difference? Throughout this presentation, we have discussed the community demographic and the problems such as marijuana and excessive alcohol use disorder. We learned how and what SBIRT description is and how we can use those steps accordingly in our approach. We learned that a fantastic resource for use for our patients to utilize is Aruka Institute of Healing. The importance of improving population health outcomes to our community, and how we as healthcare providers and professionals can make an impact by recognizing our patients' signs and symptoms of substance misuse. And together we can make a difference not only in our communities, but for our patients' well-beings. So if you guys have any questions at all, feel free to ask me. If you're not live on here right now, if you have any questions, you can message me on Facebook Messenger, text me, whatever. And I will hopefully be able to answer those for you. Okay. Thank you guys so much for taking the time out of your day to watch this presentation. Below, you'll see my references here. So thank you very much for being a part of my educational journey. Take care.